Mr. Chairman and members of the subcommittee, my name is Karen Lerner, and I'm a registered nurse and a wound care support service and rehab specialist for Allcare Medical in Sayreville, New Jersey. Allcare has been in business since 1963. We have 200 employees and serve about 25,000 patients per year. Allcare Medical is a member of the Jersey Association of Medical Equipment Services and the American Association for Home Care. I am here today representing the home care community. My goal is to explain why this competitive bidding program, as designed by CMS, will not achieve its desired outcomes and will in fact reduce access to care for Medicare beneficiaries, lower the quality of that care, increase costs, and kill jobs. We agree with the 255 members of the House of Representatives who believe this program should be scrapped. Numerous consumer and patient advocacy organizations also believe the bidding program should be eliminated. The fundamental flaw in the design of this bidding program for durable medical equipment is that it treats home medical equipment and services like a simple commodity. We are not equipment deliverers, we are a service provider. In fact, effective home-based care for our nation's seniors and people with disabilities is an integral part of the continuum of care that helps move patients swiftly from hospital to the home. It helps to keep people out of nursing homes and the emergency room, and it reduces hospital admissions. Many frail, elderly, and disabled Medicare beneficiaries require multiple items of medical equipment. Consider the chaos that will occur when a caregiver must call 5 or 6 different companies to coordinate the medical equipment needs of a patient who requires a hospital bed, support surface, oxygen, enteral feedings, and a walker. I have seen many, many patients like this. As a nurse and an assistive technology professional who helps patients get fitted for the right type of wheelchair, I'm in contact with patients every day, and it scares me to think of what will happen to these patients if this bidding program becomes reality. The current marketplace without competitive bidding requires home care providers to compete for patients on the basis of service and choice, to furnish the home medical equipment that makes the most clinical sense for the beneficiary. We are currently reimbursed under fee schedule in Medicare, which CMS and Congress have cut repeatedly and disproportionately over the past decade. So the contention that the DemiPros fee schedule is outdated and is based on pricing from 25 years ago is incorrect. The home medical equipment sector has already seen reimbursements cuts of nearly 50% to the Medicare's fee schedule over the past decade. Despite all the quality assurance and measuring tools that CMS has previously touted, patients and even most physicians will not know if they are getting clinically appropriate equipment and services until negative outcomes appear. With respect to all of the promised savings and advantages of the competitive bidding program, I maintain that what sounds too good to be true is too good to be true. This ill-conceived program will single-handedly destroy the home medical service sector, harm the patients we serve, and ultimately increase Medicare costs. Now let me describe the problems we have seen in the rebid process. A provider in Ohio was offered a contract for a respiratory device, but they didn't have a respiratory therapist on staff, contrary to the bidding rules and contrary to Ohio law. One of the largest home care companies announced in July 2010 that it was offered 17 contracts in the first bid, despite the fact that in June 2010 it had $513 million in long-term debt, was considering restructuring or filing for bankruptcy, and expects to lose up to $900,000 in the bidding areas in the first quarter 2011. Let me speak to the issue of transparency. 136 members of Congress who sent a letter to CMS recently believe that CMS has not shared enough information about the program. Transparency is intended to protect the public. The lack of transparency makes deficiencies in the program and makes it impossible to evaluate fully the way CMS reached its various decisions at every stage of the process. From an administration that touts its openness and transparency, we have seen none with this program. On the question of fraud prevention, first let me say that home medical equipment providers have no tolerance for fraud, but arbitrarily limiting the number of legitimate providers in the marketplace will do nothing to stop those whose only intent is to defraud the Medicare program. The HME community should not be penalized when CMS grants Medicare billing credentials to an empty closet. The government is simply not doing an adequate job of site inspections before awarding suppliers. As a nurse and with direct experience in the home care medical field, I believe this program will increase costs rather than save money. Patients I see will suffer through limited access to clinically appropriate equipment and services. It will reduce the quality of equipment beneficiaries they receive, and many will end up in the hospital. This program cannot be fixed as it is designed. Therefore, James, AA Home Care, and a large number of patient organizations believe that Congress must immediately stop the implementation of this bidding program and work with the HME community to ensure accurate pricing while at the same time ensuring access to quality care for Medicare beneficiaries. Thank you again for the opportunity to provide testimony.